Hi, this is Galit Goldfarb. Thank you very much for joining me here today. Today I'm going to be talking about ulcerative colitis remission with diet and supplements. Ulcerative colitis is an inflammatory bowel disease that causes long-lasting inflammation and ulcers in the digestive tract. The disease leads to malabsorption of nutrients and all sorts of nutrient deficiencies due to the malabsorption, and severe weight loss, and also osteoporosis because of lack of nutrients. The disease often begins gradually and may become worse over time. And most people who have ulcerative colitis have periods of remission when the symptoms can disappear completely. Remission periods can last for weeks or even years. While there is no recognized cure as of yet, ulcerative colitis has natural remedies that can significantly reduce the symptoms and lead to long-term remission. So let's talk about diet. Many people go for years suffering from painful and embarrassing symptoms, often seriously affecting their quality of life. But there are certain foods and diets that have been shown to lead to either ulcerative colitis flare-ups or remission periods. While everyone reacts differently, certain foods have been known to be common triggers for ulcerative colitis. So first, let's talk about the foods that increase the risk of flare-ups. Increased consumption of sweets has been shown to be positively associated with ulcerative colitis. In fact, the European Investigation into Cancer and Nutrition study reported that increased consumption of sugar and soft drinks and accompanied by low vegetable intake was positively associated with ulcerative colitis risk. High-fat foods and processed foods have also been associated with ulcerative colitis. And also, the common food additive carrageenan has been shown to affect clinical relapse rates and to aggravate disease activity. Also, alcohol is something that you definitely want to avoid. Now let's talk about the foods that decrease the risk of flare-ups. High vegetable intake was found to be associated with decreased risk of ulcerative colitis, and fiber. Although if you read in certain places, it says to avoid fiber-rich foods, this is not true. Fiber is essential for reducing pain and other symptoms of ulcerative colitis. Fiber also soaks up that extra water in the body, in the digestive tract, that leads to a lot of pain, and it also makes the stools firmer. This is very important in reducing the pain that accompanies the growth of the digestive tract. Now, also studies show that a diet lacking in dietary fiber will accelerate microbial imbalance in the gut of people. This is detrimental for the condition of ulcerative colitis. So for this reason, I definitely recommend consuming whole grains, especially rice and quinoa and oats. This is very beneficial for people with ulcerative colitis. Also, exclusion diets have been known to be helpful for some people. There is the FODMAP diet. Research has shown that some people have very sensitive guts, and they are especially sensitive to fermentable foods, oligosaccharides, disaccharides, monosaccharides, and polyols. These are otherwise known as FODMAPs, and these can trigger symptoms of ulcerative colitis when these foods are poorly absorbed in the small intestine. So researchers from Monash University in Melbourne developed a low FODMAP diet for people suffering from ulcerative colitis. This is a diet that should be considered for short-term periods, since it is very, very restrictive, which may prevent sufficient nutrient intake. So I recommend to follow the FODMAP diet strictly for 1 month if you're interested in doing an elimination diet, as the FODMAP is. So try it for a month, and after this, slowly reintroduce other foods back into your diet to determine their effect on your condition. Now, there are other exclusion diets. These diets remove and slowly introduce eggs, wheat, milk products, corn, tomatoes, rice, soybeans, cod, shrimp, and other fish, mushrooms, and other meat dishes. These elimination diets were shown to be helpful, and studies show that with comparison to a normal controlled diet, following an exclusion diet was associated with significant decrease in ulcerative colitis scores and improved the quality of life of these people that were suffering. Now, it is wise, therefore, to keep a food diary, which will help you identify which foods trigger your flare-ups. The only way to know for sure if a particular food is causing your problems is to remove it from your diet and then after some time slowly start eating it again. Now, you will want to reintroduce foods into your diet one at a time to see which ones trigger the symptoms, of course. For example, you may reintroduce a particular fruit for 3 days and then a particular grain for 3 days. If no symptoms if no symptoms appear, then you can introduce more and more foods and so on. That's how it goes. So once the triggering foods are identified, you will know what to avoid and what you can eat without worrying. Now you can then use this information to formulate your own personalized menu that keeps your symptoms to a minimum. Also, eating frequent meals is very important. If you're losing lots of weight because of ulcerative colitis, if you try eating smaller meals throughout the day, this will prevent your discomfort from the inflammation. Eating little and often is proven to be very helpful during flare-ups. Now, if you also have chronic diarrhea, you want to drink sufficient water so that you will stay hydrated. Now, there are supplements that have shown to alleviate symptoms of ulcerative colitis. These supplements have been proven to lengthen remission periods and reduce symptoms during the flare-ups, and these include omega-3 fatty acids. Many dietary studies have shown that the omega-3 fatty acid known as eicosapentaenoic acid, EPA, can combat inflammation. The adequate daily intake of EPA for adults should be at least 220 milligrams per day. Now, if you choose a fish oil, I recommend plant-based omega-3 fatty acid supplements. But if you do choose a fish oil supplement, read the label to check the EPA levels in the supplement, since it is not the same as the amount of fish oil written on the label. Now, people who take blood-thinning medications must consult with their doctor before taking omega-3 fatty acid supplements to check if there is a safe dose on their with their medication, or even if the supplements can replace their blood-thinning medications overall. Now, also another supplement is probiotics. Probiotics have been shown to be effective in treating ulcerative colitis because they provide you with good bacteria, healthy bacteria, reducing immune responses. Now, best probiotic foods include sauerkraut, natto, kimchi, miso, and kombucha. Another kind of food that helps fight ulcerative colitis is manuka honey. I'll do a video about that as well. Now, one meta-analysis shows that probiotics could prevent relapse of ulcerative colitis as effectively as the prescription medication used to treat all types of inflammatory bowel syndrome, mesalazine. Now, iron is another supplement. It prevents anemia and is a nutrient needed to maintain overall health and metabolism. Iron-rich foods include navy beans, spinach, or black beans. I wouldn't recommend supplementing with iron unless you are found deficient through your blood tests. And if you are deficient, I wouldn't recommend taking more than 25 milligrams of iron bisglycinate 2 to 5 times a week. I wouldn't even go for 5 times, so 2 to 4 times a week, depending, of course, on your deficiency levels. Folate is another essential vitamin for people with ulcerative colitis because it helps the body produce new cells. Folate-rich foods include chickpeas, lentils, asparagus, avocado, beets, and broccoli. You may also take a folate supplement to ensure you have sufficient intake. Now, turmeric, one of the best benefits of turmeric or curcumin is the ability to prevent inflammation. An analysis of all the studies made about curcumin's ability to control inflammatory bowel issues showed that many patients could stop taking their corticosteroids because their condition improved so dramatically by taking curcumin. So also another randomized controlled trial of 82 people with ulcerative colitis demonstrated that a dose of 2 grams per day, 1 gram in the morning for breakfast and 1 gram following dinner, when added to their standard therapy, significantly reduced their relapse rates. Another vitamin definitely you want to think about is vitamin D. It has a very wide variety of critical activities within our bodies, and vitamin D deficiency is widespread among ulcerative colitis patients. One study reports that patients with ulcerative colitis had more than double the odds of vitamin D deficiency compared with healthy people, with healthy control people. Now, given that vitamin D status appears to be an independent risk factor for potential poorer outcomes of inflammatory bowel disease and ulcerative colitis, then supplementation of vitamin D is crucial for this population. So if you are suffering from ulcerative colitis, definitely you want to supplement with vitamin D. Daily doses of 1,800 to 10,000 IU, international units of vitamin D3 cholecalciferol, are recommended depending on the baseline vitamin D serum concentration that you have in your blood tests. Now, to summarize, I recommend eating little and often, drinking adequate fluids, decreasing excess intake of fats, decrease simple carbohydrates, and including sugar, and eliminate dairy products during flare-ups. Now, I also recommend consuming complex carbohydrates daily, high-fiber foods, including fruit, vegetables, and whole grains and legumes. I recommend supplementing with the nutrients that I recommended in this video, and if you have deficiencies, supplement with those nutrients to help reduce inflammation. So I hope you liked this video. If you did, please give it a thumbs up. Please subscribe to my channel if you like the content. I upload new content once a week on nutrition and wellness, and every day I upload health coaching videos. Please also visit my website at thegorilladiet.com for lots of health and weight loss programs, books, and everything to help you reach your goals in the health and wellness side of your life. So thank you very much for joining.